The news, good evening. Representatives of the Ministry of Education today met the head teachers as well as presidents of the councils for primary and secondary schools in the country. The purpose of the meeting was to get the points of view of the participants on the operational plans for the schools, which were presented to them in their first meeting last Tuesday. The plans are based on three principles: social distancing, hygiene and vigilance. Each school established a task force which had the mandate to oversee the implementation of these plans. This morning, the establishments shared their plans as well as their concerns, and they also made suggestions. Primary, secondary and creche students return to school for the second school term next Monday, May the 18th. President Danifo visited nurses and other health workers at the Onswalo Clinic, as well as midwives and nurses at the maternity ward. His visit as a Minister for Health coincides with International Nurses Day today and Midwives Day, which was observed last week. President Faure sat with the health workers to listen to their challenges and issues. He has reassured the nurses that although the country is going through an economic crisis at present, the government will pursue implementation of the revised scheme of service for nurses. Our nurses shoulder some of the biggest healthcare burdens, and their skill and commitment makes a life-saving difference every day. President Faure said this in his message to nurses on the occasion of International Nurses Day today. He said government will continue to invest in high-quality education and training for our health professionals. We also remain committed to supporting and recognizing the hard work for those in the nursing profession. The message says the day that always deserves to be celebrated, but carries extra significance and meaning as nurses continue to serve on the front line of the COVID-19 pandemic. And as we celebrate the 200th anniversary of the birth of Florence Nightingale this year, the founder of modern nursing, we owe all nurses a deep appreciation for their care and sacrifices. L'Union démocratique Seychelloise, the LDS, has joined together with the people of Seychelles in expressing support and solidarity with all nurses. Also on the occasion of International Nurses Day, LDS has paid tribute to the men and women of this honorable profession for their work, which contributes so much to the national well-being. The message says that good health is a precious gift and blessing for all human life, and we owe much to those who help us regain it when it slips or fails. And in this time of special danger because of the COVID-19 pandemic, they have even more reason than usual to be grateful to the caregivers. LDS joins together with all the people of Seychelles in expressing support and solidarity with those who have faced the greatest danger in their line of work and in their mission to keep us safe. Better social distancing is what the Public Health Commissioner, Dr. Jude Gédéon, has emphasized on during today's press conference about the COVID-19 situation worldwide and in Seychelles. Dr. Gédéon reiterated that this practice will be very important. In the eventuality that there is a second wave of the COVID-19 pandemic in the country, Dr. Gédéon also gave a summary of COVID-19 tests done in the country, with 72 which were carried out on the 11 confirmed cases who were isolated, and about 800 tests altogether, including people who were placed in the different quarantine centers. The department
that many people are putting a lot of effort, and we congratulate them for that. Many organizations have embraced the guidelines, they are applying them, they're using their energy, and we're happy to note that there is that effort, there is that commitment. However, we have a group of people that still maybe have not gotten the message It's just like in a class when you teach a group of students, some will be fast learner, but others will be slower learner. You'll need more effort, you need more energy, you need more patience, so that the slower learner can also learn the things that you want them to learn. So we'll not stop our effort to educate about the right preventive things that we want people to do. And today, of more concern for us is social distancing that needs to improve.
The Health Department also announced that repatriation of sexual work patients who have completed their treatment in India and Sri Lanka will start of this weekend or early next week. On the other hand, several services like surgeries, dental services and special clinics are resuming soon. The Health Department is calling on members of the public to respect their appointments. Visitors to the Seychelles Hospital will also have their temperatures checked. Visiting hours will remain for 1 hour between 2 to 3 p.m. and the number of visitors is still restricted to 3 per patient, with each one visiting in turn. The government spent 4.3 million rupees in February under the Welfare Assistance Programme, 4.6 million in March, 7.5 million in April, and is expected to go over 10 million for this month of May.
This is to help people who have lost revenues because of the COVID-19 pandemic. Family Affairs Minister Mitsilari gave these figures while answering several questions from the leader of the opposition, Wiver Ramkalawan, in the National Assembly this morning. Following another question on the same subject, designated Minister Maxuzi Mordon says that during a national emergency, the local government department is responsible to identify those most vulnerable and what kind of assistance they need. She adds that the department undertakes this task together with several other agencies.
The Land Transport Agency has resumed reconstruction work on a bridge in Baie-Saint-Anne-Pralin, a bridge which is not too far from the community centre. The company, All Weather Builders, is undertaking work on the bridge as part of a project that is costing the agency 575,000 rupees. The work had started in March, but there was a pause in view of the restrictions imposed on people's movement because of the COVID-19 pandemic. And with this, we end this news summary. Thank you for watching. Have a pleasant evening.